I thought that it was a wonderful experience and a wonderful debate looking at the pro position and the con position. I was assigned the pro position. And so basically, I argued from the existing literature that psychotherapy shows a significant reduction in patients with psychogenic non-epileptic seizures. I based that on a few different trials that have been published in the literature. They were based on a specific type of psychotherapy. In the literature, it's called cognitive behavioral therapy informed psychotherapy. So you'll see it listed as CBT-IP. The other name for that therapy is neurobehavioral therapy. The reason why I say about this therapy is because it's not cognitive behavioral therapy. There are elements of cognitive behavioral therapy in neurobehavioral therapy, or the CBT-IP that I mentioned, but it's a multimodal intervention. And what that means is we've taken the best of the different psychotherapies and we target them to the known pathologies in patients with psychogenic non-epileptic seizures. So by doing so, we know that there are problems with communication in patients. So there's a specific section in the therapy. There's a specific session dedicated to interpersonal therapy where they learn healthy communication skills. We know that patients with psychogenic non-epileptic seizures are many times prescribed a number of anti-seizure medications or anti-epileptic drugs inappropriately because AEDs don't treat non-epileptic seizures. So there's a whole section on psychoeducation where the patient is educated about the indications and side effects and treatment effects for anti-epileptic drugs and for psychotropic medications to help with comorbid depression and anxiety. So they are informed through psychoeducation on perhaps I don't need to be on this medication, maybe I need to be on a different medication. So those are two examples: interpersonal therapy, psychoeducation, distress tolerance from a dialectical behavioral approach, acceptance and commitment therapy, psychodynamic psychotherapy, and conventional cognitive behavioral therapy. All of those are different elements in neurobehavioral therapy. Using that intervention, we found in civilians and in veteran studies that we've conducted a significant reduction, over 53 to 59% reduction in per month in patients with psychogenic non-epileptic seizures. So that's the treatment that we talked about, and those are the data that we showed from the various publications why we have a pro position that psychotherapy does work.